Hello, I am Amanda Bopp.
Hello, I am Amani Henderson, and we're going to tell you what we thought we knew about the medical field.
Going into this year, we had some expectations about how medical school ran.
We thought if you make one mistake, you were cut and your chances for a career as a doctor were over. We thought everyone was competing against each other and it was more of a cutthroat process. But boy, were we wrong.
After reading the book, The Real Doctor Will See You Shortly, we realized that medical school comes with long hours, lack of sleep, and many mistakes. The first 2 years of medical school are the core of the academics, and the last 2 are the clinicals and rotations.
Our medical student guest, Amal Yeha, told us that people support each other and push each other to do better in medical school. It is not a ruthless environment at all.
Amal also taught us that you don't have to get any clinical experience in medical school until the last 2 years, which is something that I didn't know.
There are some cool things like intubation and stapling wounds that we learned this year that some med students don't learn until their third year. For intubation, we learned that you have to make sure the patient's head is back and pull their chin up. Then you use a scope to guide you in the tube down their throat. You make sure that the tube is 22 inches down the throat, and then you pull the plastic piece inside the tube out. Afterwards, you take a syringe of air and attach it to the thing hanging off. You decompress the syringe to inflate the balloon, which holds the tube in place. After, you attach an oxygen bag to the end and squeeze to get air inside the lungs.
At Truro College, we learned that to staple the skin, you must take the tweezers and pinch the skin closer together. Then you hold the staple gun upright above the skin, put the staple gun against their skin, and staple. You repeat this process for the length of the suture. This year, we learned a lot about how insurance works, and it is more complicated than we thought it would be. Before New Visions, we thought that most people in America were insured, and it was easy to get insurance without much trouble. We figured that in an emergency, the insurance company would cover whatever the cost if it meant that it would be saving a person's life. In class, we learned that these things were exactly true.
Deadly Spin taught us that there are millions of people where money is more valued than a human life. Wendell Potter described an incident where the insurance company WellPoint began conducting investigations on women with breast cancer with the intent on discontinuing their insurance policies. These women needed to be supported by their insurance in order to keep continuing their fight against cancer, but the company was more concerned about how they could save money. This is an example of a company favoring money over how they can positively impact their consumers' well-being.
From Mr. Delaron's presentation, we learned how much excessive and unnecessary spending is in the healthcare system. There is $750 billion per year of waste in the U.S. healthcare system, and 25% of appointments are missed in the U.S. Compared to other healthcare systems around the world, the U.S. has higher costs, higher prices, worse outcomes, and poor patient experiences.
He also told us that pricing of medical procedures and medication is different depending on your location. If there's a short in a medication, prices will increase. This relates to what we learned in economics about supply and demand.
We learned another aspect of healthcare from a current event about the Medicaid expansion. The Affordable Care Act, or Obamacare, was signed into law in 2010. This expanded healthcare coverage to adults with incomes at or below a federal poverty level. This now expanded coverage to the low-income children and some of their parents, poor pregnant women, certain low-income seniors, and some individuals with disabilities who are under the age of 65, who didn't before meet the criteria of Medicaid. This expansion also cuts the rates of uninsured veterans and Native Americans in half and provides early treatment to people struggling with HIV.
Along with learning about economics associated with insurance, we learned that the struggles of budgeting your money throughout life. We both figured that making a decent amount of money means that you could easily have a great home, send all your kids to whatever college they desire, and live a comfortable life. We both learned that these things aren't that easy.
In economics, we learned that it's hard to support a family of 4 on a small amount of money. People have to get food stamps or live in small places with their whole family because it is hard to support everyone and live comfortably. Budgeting is very important in order to make sure that the family is going to survive through the month. Even when you think you have a lot of money, you really don't. Being on rotations in the hospital has also showed us different aspects of the hospital that we didn't know. One big aspect is how important and serious it is to follow the HIPAA laws. Nurse Sandra taught me that you are not allowed to say anything about people who you know or give out names of the people that you have seen, and she also told me about the consequences of breaking HIPAA laws.
Rotations have also showed us the important work that nurses do. Even before New Visions, you knew that you saw the nurses more than doctors just from personal experiences. We also knew that nurses were busy, but we didn't realize how busy they actually were until this year. Being in the hospital has allowed me to see all the struggles and crazy things that nurses have to go through.
When I was on rotation in med-surg, I was shadowing a nurse named Adriana Rice, who was up to her eyeballs in patients and work. She was taking care of 6 patients while also going to rounds to report to the rest of the hospital staff on how her patient statuses were. Watching her run around all day made me gain a deep appreciation for the amount of work that nurses really do. Being on rotations isn't the only way we learned about nurses' busy lives.
Over the summer, we read the book, The Shift, and it took us through a 12-hour shift of an oncology nurse. She had 4 patients to look after, all of which had different circumstances. One was a returning patient, one was put on a powerful drug that could kill him, one may have been misdiagnosed, and the other was being discharged after 6 weeks in the hospital.
This book and being on rotation showed us that nurses have busy lives, and prioritizing and attending to the needs of their patients takes skills, sensitivity, and humor in order to obtain good outcomes. A nurse's main priority is to improve the quals of a patient, and nurses continue to do that every day. A patient-physician relationship is an important part of healthcare that we need to learn the importance of when coming into New Visions. We expected that a physician would have serious attachments to their patients, and we were right. We also learned how difficult it is for a doctor to be in the role of a patient.
And how doctors think, we were able to understand how developing a close relationship with your patient can alter a patient's treatment. In the book, when Dr. Balchuk began treating his family friend, he enjoyed his company so much that he didn't want to put him through any invasive tests to treat his indigestion problems. The patient's symptoms became worse and later found out that he had gastric lymphoma. The doctor most likely would have made this diagnosis earlier if he didn't have a pre-existing relationship with the patient, because he wouldn't care about giving the patient an invasive test as much.
In the book, When Breath Becomes Air, a neurosurgeon developed lung cancer, and he fell into the reverse role of being the patient. In this type of relationship, it was difficult to treat the doctor because he was so knowledgeable about most of the treatments, so he felt like he knew what was best. This book made me think about the patient-physician relationship from a different perspective.
Before we were in the hospital on a regular basis, we weren't aware of how common it is to see people with kidney problems and drug issues. There was one patient that I saw in the hospital that had kidney disease and was on dialysis, but hadn't been going to his treatments. The patient complained of pain and severe swelling. It was clear that he needed to continue his treatments. He wasn't allowed to drink any fluids, but was given them intravenously periodically at small amounts. He was also given pain medicine as well. In a disease presentation, I learned that dialysis makes sure that the waste products in your body don't reach dangerous levels by doing the function of your kidneys and filtering out the waste. On another rotation, I was able to see Dr. Silk put a dialysis port into someone's chest, which was really cool.
Rotations have showed me how many people come in with drug addiction. When I went to the MICA unit with Nurse Jenny, I was able to sit down with people in withdrawal from drugs and hear about their stories, how they were feeling, and the next steps that they needed to take to recover. One patient was addicted to heroin, and I was able to understand the effect of the drug from listening to a disease presentation. While I was listening to people's stories, they talked about things that they do to get their mind off of things, and what they do to make them feel better. This reminded me of Silver Linings Playbook, because the characters had mental problems, but they took on new hobbies in order to get their mind off of things.
When I was at Troy Family Health with Nancy Harris, I met a patient that was recovering from cocaine. I got to see what steps needed to be taken to help the patient continue their recovery, which was really interesting.
One disease that I didn't know much about before New Visions was shingles. I knew that you could get a really bad rash, but I wasn't aware of how painful it can be. Through a disease presentation, I learned that if you've had chickenpox, the virus lies inactive in the nerve tissue near your spinal cord and brain. Years later, the virus may reactivate as shingles. Getting vaccinated can reduce your chances of getting shingles. Vaccinations are a positive extremity because it is an action that has a benefit to other people around you.
Reflecting on all the work that we have done has shown us how much we have grown.
Goodbye, and I'll miss you.